Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of the NAAOP. It's been a busy week in Congress, and May is expected to be an extraordinarily busy month. Thus far, the House has passed an omnibus spending bill for fiscal year 2017. Of course, 6 months of this current fiscal year has already elapsed, so the bill would fund the federal government through the rest of the fiscal year, which ends on September 30th. That ensures that the federal government will not be shut down on early on Friday. The issue is that now the Senate will need to pass this bill, and it is expected to do so. And the President has signaled that he will sign the legislation. Also, this month will feature health care reform in the form of passage in the House of the American Health Care Act. If the Republicans are successful in getting enough votes to gain consensus around that legislation, the legislation will finally move over to the Senate for the Senate to debate the bill. Currently, the House does not have the votes, but there are indications that the moderate Republicans are starting to come on board and joining the conservative Republicans to try to get 217 votes in order to pass the bill. Currently, there are a couple of amendments being added from the moderates to complement some of the amendments that have been added to attract the conservatives. One of the amendments is quite troubling. It involves waivers being granted to the states to override and to essentially eviscerate essential health benefits protections. And that's a problem for NAAOP and its members, and particularly for patients who rely on orthotic and prosthetic care. Essential health benefits is the provision in the Affordable Care Act that has led to coverage, widespread coverage of orthotics and prosthetics in many, if not the vast majority, of private health plans and in Medicaid expansion states. And so eliminating or giving the states the ability or the authority to waive requirements on essential benefits is a major problem, and NAAOP has communicated that along with many other organizations to Capitol Hill. Stay tuned on the American Health Care Act as the House makes a decision as to whether it can move the bill forward. And then, of course, all the action will be centered in the Senate as the Senate takes on the bill and tries to pass that as well. But there's other things that are a much more specific impact to orthotics and prosthetics that have been occurring simultaneously. First off, NAAOP has been working with key House supporters to reintroduce the Injured and Amputee Veterans Bill of Rights. That's a bill that has been in the last few Congresses. We actually did get the bill passed in the House at one point, but it didn't pass the Senate. We'll be seeking to reintroduce that legislation very shortly, and we'll be reaching out to members to seek co-sponsors for the bill. That bill would make veterans more aware of their rights to secure comprehensive orthotic and prosthetic care, to choose the practitioner that they believe will best meet their needs, to choose the technology that's appropriate for their condition, and similar rights. Second, Performant Recovery is a recovery audit contractor for the Medicare program, which focuses on DMEPOS, durable medical equipment, prosthetics, orthotics, and supplies. And recently, Performant announced an audit issue that they plan on pursuing with respect to knee stance flexion. The knee stance flexion code is something that they believe should not be used and is incompatible with a whole series of single-axis knee codes. We object strongly. We've been working with the Orthotic and Prosthetic Alliance to oppose this new audit. We don't believe it is a well-founded or an appropriate audit to undertake, and ultimately we'll seek to try to have that rescinded. Interestingly, the Performant Recovery Auditor did remove the issue and the announcement that it had made off of its website recently. We'll see if that takes, and we're communicating directly with CMS on behalf of the Alliance and NAAOP specifically to try to get that permanently rescinded. Finally, the LCD process from a year and a half ago was a real debacle. This is where CMS announced a lower limb prostheses LCD that was so restrictive that it would have sent amputees back to 1970s levels of care. It simply was not consistent with the standard of practice these days. CMS did, in fact, after tremendous response from the O&P community, did in fact pull that draft LCD and did not implement it. Instead created an interagency work group on lower limb prostheses. That work group has yet to report its findings. It's an all-federal work group. There are no outside stakeholders on the work group. It's been very secretive. We don't know what they've been discussing, what they plan to propose, but we do expect that they'll be ready to speak and produce something for public comment at some time in the fairly near future. So we're following up with that to try to figure that out. But in the meantime, there has been legislation introduced that NAAOP supports. The legislation is on the NAAOP website at www.naaop.org. We encourage you to go to the Congressional Action Center on our website and send an email message to your 2 senators encouraging them to support the LCD Clarification Act of 2017. This legislation essentially would make the local coverage determination process much more transparent and accountable, much like the processes that are in place for national coverage determinations. So we encourage you to do that at your earliest opportunity and encourage your senators to co-sponsor this important legislation. Thanks so much.